Hello, welcome to Rethinking Treatment. Our topic for today, acute and chronic shoulder pain. What's the Western approach and what is our concept, especially for the severe and very severe cases? Well, what is behind acute and chronic shoulder and neck pain? There are many different causes behind it. Well, of course, there is always tension in the muscles. But the basic reason may be in the vertebra, may be in burden by a huge amount of work. There are many different psychological disorders and acute functional disorders behind it. What's the most used treatment approach? Well, just the symptomatic approach, giving pain relieving drugs. Just giving a substance that reduces the pain but not targeting to the root of the disease. Well, at the best, you will get a recipe for physiotherapy. This is of course very wise in many cases, but most of the time you will get only a short time effect on this. Once in a while, other methods may be helpful. Local treatment with heating of the tissue. Osteopathic methods may be helpful. Well, but there is an extraordinary valuable method, the use of low-level laser therapy. A good friend of mine, Roberta Cho from Australia, treated numerous patients with these acute and chronic pains, and she looked into the literature, put all the literature together, and published a so-called meta-analysis. 800 patients were included into this study, and just imagine, none of these patients complained of any side effects. What does happen with the pain-relieving substance? We get side effects of stomatitis and other problems. Besides talking of the side effects, we want to achieve an effect. And all these patients reported on immediately reduction of pain shortly after the treatment. And it was not only a short time effect, all these patients reported on lasting pain reduction for at least 22 weeks after completing the treatment. Well, at the best, you don't only use the laser locally, but combine it with the treasures of Chinese medicine. Think about what Chinese says, liver and gallbladder stagnation. That may be the underlying cause, the root for the tension. There are acupuncture points, like this point, an extra point, not on a traditional meridian, that is called stiff shoulder, if you translate it from Chinese medicine. Well, what can you do on your own? Avoid too much stress load. Find measures for relaxation. Use local warming. Discuss with your therapist about physiotherapy, maybe osteopathy. Be open. Find a therapist who uses a combination of Chinese medicine with the advantages of low-level laser therapy. In this sense, stay healthy. All the best for you and your patients. Michael Weber from Senden, Germany.